I want to start by thanking my opponent Paula and the class for adding to the online discussion this week. This is my closing argument for the affirmative position that individuals with lifestyle-related chronic diseases should pay additional taxes given the additional health care that they require. There are many facts and statistics that my opponent and I agree upon. We agree in the statistic reported by the Government of Canada that 4 in 10 Canadians have at least one chronic condition. Some studies actually report this to be as high as 6 in 10. We agree in the financial toll chronic disease exerts on the Canadian economy. Chronic disease and illness cost the Canadian economy $190 billion annually. According to the Public Health Agency of Canada, in 2016, chronic diseases accounted for 58% of annual healthcare spending. We also agree that chronic diseases are generally preventable and are primarily caused by common avoidable lifestyle-related risk factors, including tobacco use, unhealthy diet, insufficient physical activity, unhealthy weight, and harmful use of alcohol. These are referred to as modifiable behaviors because they can, in theory, be changed. Where our opinions begin to differ is why. My opponent will refer to the social determinants of health, and she is not wrong. Adults with the lowest socioeconomic status were more likely to be current smokers, physically inactive, and consume fewer fruits and vegetables than those in the highest socioeconomic status. My opponent will refer to the disproportionately high impact chronic disease has on Indigenous people, and she is not wrong in doing that. But let's crunch the numbers for a minute. In 2019, Public Health Ontario reported that 42% of adults were physically inactive, reporting physical activity levels that did not meet national guidelines. 71.8% of adults and 76.6% of youth reported inadequate vegetable and fruit consumption. Looking at these statistics alone, 71.8% of adults and 76.6% of youth in Ontario are not Indigenous people or those living in the lowest socioeconomic status. Not all individuals with chronic disease are stigmatized, financially burdened, or experiencing poor social determinants of health. Lifestyle-related chronic diseases are, as stated by Buchanan Barker in 2015, problems of living. Many individuals with post-secondary education, secure housing and finances, as well as access to healthcare, make poor lifestyle choices that predispose them to chronic disease, such as type 2 diabetes, heart disease, and cancer. I will close with one final thought. While imposing another tax would anger many Canadians, similar taxes for tobacco and alcohol have been successful in curbing behaviors. By reducing the prevalence of risk factors discussed, there's the potential to reduce chronic disease. Canadians would stay healthy and productive for longer, as well as reduce healthcare costs. Thanks, and have a good evening.